The History and Future of Rural Healthcare in the U.S. by Fatima Tufaha. Throughout this presentation will be centered around Chapter 2 of the current and emerging rural health issues in the Southeast United States. Chapter 2 is the history of rural health. Chapter 2 basically discusses the history of rural health in the United States, specifically during the Western expansion when the U.S. was when there was a government-backed move of people in concentrated urban areas throughout the United States. This westward expansion led to major gaps in care, especially to people as they moved to more remote areas of the United States without any established healthcare systems. Rural communities, they lacked hospitals, doctors, basic infrastructure that made it difficult to receive proper care for many people. Over time, these challenges led to long term health disparities between rural populations and urban populations that we can still see today in our society. Understanding this history is important because it is a current issue that we face. Westward expansion and early challenges. As settlers moved west, they grew very isolated from established healthcare systems. There were few doctors, no hospitals, and very poor sanitation. As you know, poor sanitation leads to more diseases like cholera and smallpox at the time. Those were very dangerous and led to many deaths. On top of that, there was limited infrastructure. Like there wasn't much communication. You wouldn't see hospital signs. There wasn't directions to the nearest hospital or doctor that you could easily go to if you needed medical help. Urban versus rural divide. During this time, there became a very clear divide between the health offered in urban areas versus rural areas. Urban areas had hospitals, medical schools, trained physicians, and training physicians. They had this growing environment that continued to improve its quality of care. And that was in complete contrast to rural areas that had very limited access to healthcare. There were fewer providers, less facilities, almost no facilities in some areas. And people had to often travel really long distances for very basic care. This divide is not just a temporary issue, it created long term disparities in healthcare. How rural communities survived? Rural communities survived through several processes, even though they didn't have professional medical care. One was traditional care, just through home remedies like teas and herbal treatments, homemade ointments, professional care. Some traveling doctors would come through different Western towns. These were called circuit riders, and midwives aided with childbirth. Overall, care was just inconsistent. There wasn't any specific guidelines. It was almost everybody to themselves. Government policy and intervention. The government started to pick up on this big shift between urban communities and rural communities because the urban communities were growing so quickly with state of the art technology and medicines and medical care versus rural areas, they were stuck in the past. So the government started to pick up on this, and around the 1930s, they put in the New Deal programs. They indirectly did improve health of people. They improved sanitation policies, communication, living conditions, electricity. While these didn't directly affect health, they indirectly improve people's health because, for example, improving sanitation lowered disease rate. The Hospital Survey and Construction Act funded the improvement and building of hospitals in very underserved areas. This was a great help, but it didn't reach everybody. Hospitals were only built in certain parts of the country. So, modern solutions, what we can see this apply to in policy work is telemedicine. Telemedicine allows much easier access to doctors and specialists, and specifically specialists is an interesting point because the chronic illness is very high in the United States, and some people with chronic illness need to see a specialist very regularly, so they are unable to do that due to the distance. Telehealth allows people to connect through technology, and along with that, there is rural health clinics that offer primary care and medical and mental health services and community health centers. The Preserving Telehealth Hospitals and Ambulance Access Act also expanded telehealth and access coverage. Policy and ethical consideration. Rural disparities are systemic issues. Policies aim to reduce these gaps. However, there are barriers even with telehealth. For example, not everybody in a rural area or an underserved community has the means to have technology or Wi Fi, so that could be another barrier that could affect health within rural communities. In conclusion, cultural healthcare disparities have historical roots and policies have improved access over time. However, even though these policies have improved healthcare access within rural communities, there are still gaps, and there is still solutions that need to focus on health equity, on providing fair, not just equal, solutions to healthcare, providing accessible means to everybody, even those who don't have technology to use telehealth. And these are my works cited. Thank you so much.